The relationship between pelvic floor dysfunction and breathing, that's the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine. Stay tuned. So one of the things that is pretty much ignored when it comes to pelvic floor dysfunction, incontinence, has to do with the breathing, but you have to understand some very, very basic concept. Instead of being so busy trying to do something, you got to go back to the basics. So we have we have more than two diaphragms, but for the sake of this video, we're going to concentrate on two diaphragms, your abdominal diaphragm and your pelvic floor diaphragm. Imagine an elevator up here and going to the bottom floor, which is your pelvic diaphragm. Abdominal diaphragm, pelvic diaphragm. So the elevator, as you know, you get on the floor, or on the elevator, it goes down and hits the bottom floor. It goes down a little bit and comes right back up, right? So it's not going sideways, it's not going tilted. If your pelvis is tilted forward like so, the bottom floor is not leveled to the parallel to the top floor, it's tilted. If this is your posture, it's tilted up. Once again, it's not stacked on top of the top floor like it is here. In our body, this is your pelvis. Your abdominal diaphragm is here. Your pelvic diaphragm is here. Your pelvic floor muscles is just below it. So if that's the curvature in your pelvis, your pelvic diaphragm is here and it can go within that cavity and come back up. That movement, that progression of pressure from the abdominal diaphragm down to the properly aligned pelvic diaphragm, that movement strengthens as well the integrity of the pelvic floor muscles. So every breath you take strengthens this floor. That's because that's the bottom of you. So one of the things that is not really addressed properly or at all is the importance of your breathing in the integrity of pelvic floor dysfunction, which may or may not come with incontinence. There's a proper way to breathe, and that proper way is not something that a human being out there somewhere came up with. It's the breathing that all babies on this planet do automatically. That's the biological breathing, which I will put a link in the description box. Please make sure you go there. I don't think I can put it at the end of this video. Maybe we do. Okay, I'm being told we do. So we're going to make sure that we put it there. So you better understand what that even entails. In our office, we have computer devices that we attach to a belt, and we can measure that and we can coach you in that. So once that breathing is done properly, then you have what it takes to start looking at all the other things that can cause pelvic floor dysfunction and incontinence, as long as it is related musculoskeletally speaking. At any rate, if you have not checked out my website, please do so. This problem is not being addressed properly, certainly not thorough enough. It is on the rise and it is a problem. If you need to contact me, all the methods of contact are in the description box. Thanks for watching.